Good morning. It is still morning. Good morning. Thanks for taking the time to be here this morning. I am Dan Tsai. I am the 2.5-week-old new director of the Department of Public Health. You have Dr. Hillary Cunnins here to my right as well. And I thought, well, today we will be going over the latest overdose death numbers for the month of February. I thought I would just say a few things before that, and after I go through the numbers, I'll give you a little bit of a sense of direction I see for the department as well. But it has been 2.5 weeks. It's been a very intense, busy first 2.5 weeks. I've been with the team out and about in the community a lot. Been with our street teams at night. I've been visiting many of our providers, hearing from community and stakeholder groups, meeting our staff, really listening and understanding what is happening here in San Francisco. And I have to say, I am honored, I'm privileged to be joining you all in this community, our team, others across city and county government, and the many fabulous folks we work with in the communities that we serve. So with that, let me get straight to the preliminary overdose data for February of 2025. And I want to say before hitting the numbers, first and foremost, every single death from overdose is unacceptable and preventable. And you'll hear me talk in a sec about why that is so clarifying and motivating for the work that we're doing here at the department and across our communities. And these are not just numbers, they are real people in our communities, and we have to do better. With that, the preliminary number of lives lost to accidental overdose in the month of February 2025 was 61. 61 overdose deaths in February of 2025. That is an increase from 57 deaths last month in January of 2025. That is a slight decrease from 63 deaths 12 months ago, meaning in February of 2024. So that gives you a sense of the numbers there. And I would note these are preliminary overdose data that we as the department have received. I think what this really underscores is how urgent and important this work is that we have at the department. Every one of those 61 deaths is unacceptable, it's preventable, and we as a department are going to be doing everything possible to tackling this epidemic, both from moving upstream from a prevention standpoint, but also many different public health interventions to really help at the point of overdose. Some broader things I thought I would note just around how we are tackling this. So as I said, I'm on the start of my 3rd week, been out a lot with the team, with our community, with our providers. It's been a really important chance to see the work that is happening, to see what San Francisco is all about, and the amazing work happening. It's also been a chance to see what's not working, frankly, and what some of the gaps are. And I have to say, when I'm out on the street, when I'm in discussions with our providers, with clinicians, with others, people both affirm the work happening of many of our providers and partners across the city, but almost everyone agrees something has to change. And there are a few clear themes that I thought I would take just a few moments to highlight, and then we'll take questions from folks. First, my goal for the department, this administration's goal, the mayor's directive to us, is to build a more responsive behavioral health treatment system that can help as many people as possible be off the streets, the conditions in the streets, and into effective treatment and sustained recovery. That's our true north. We are going to be doing so following evidence-based public health practices with a real focus on outcomes. We do a lot of stuff We do a lot of really exciting things here in San Francisco. That's not just the department, that's other city and county colleagues and our providers and others in the community. We need to know that everything we're doing is making a dent from an overall outcome standpoint, not just on the 61 overdose deaths that I just noted for the month of February, but also for the overall health of our population and the degree of the fentanyl and stimulant epidemic that we are facing. There are 5 areas I thought I would just note briefly of what that means and practically where we're going to be focused. So first, treatment beds and capacity. We know we have gaps in our actual treatment capacity. We need more treatment beds at the right, this is very important, at the right level of clinical intensity. It's not just adding beds across the board anywhere we can find beds. It is really thoughtfully knowing where we have gaps in our treatment system, and that also means making sure we have better clinical resources across our entire, anytime someone engages with into our system as possible. Second, when someone needs or is ready for treatment, we need a better way to plug people into treatment quickly and simply. It's often too hard, too complicated, takes too long to figure out when you're with a person on the street, ready to engage in treatment, where to send them, is there capacity, which site is right for their particular clinical presentation, who can help get them there, all of that. We need to do better there. Third, well, we have a lot of incredibly innovative things happening here on the ground, like the telehealth buprenorphine prescribing for folks. We often, too often, lose people in the treatment cycle. Folks get initiated into treatment of some sort. They aren't able to make it fully through. We have folks lost as people need to transition from one setting of treatment to another in those gaps of care. We need to do a better job, we collectively, including with our community, our providers and others, being what I call sticky, helping people who engage in treatment be able to successfully make it through in their own journey, that treatment path, and through all the way to sustained recovery and often to the next level of care, of treatment or recovery. Fourth, we are going to affirm long-standing evidence-based public health interventions here in San Francisco, like sterile syringe access. But we're going to be making 2 changes. Number 1, as was clear in the mayor's directive yesterday for us, we are reassessing and will be pivoting on our policies for distribution of smoking supplies for drug consumption. That is particularly around foil, pipes, and straws for drug consumption. We will be working through that policy rapidly on the ground with our clinical folks, with our providers, with our communities and stakeholders over the next very short period of time. You should expect us to be back out to the public with that pivot in policy in the very near future. And second, anytime we have someone engaged in some way, whether it's distribution of a sterile needle, or someone is entering a shelter or the emergency department at the general, we want to take every opportunity to more intentionally, proactively, and effectively get people connected into treatment. I've been out in the streets at night, as I've noted, or visiting some providers. I've seen folks incredibly skilled in a non-judgmental way of when they've got someone in front of them, helping to support that individual to actually get plugged into a point of treatment or recovery or the next step for them. We want to make sure that happens with every encounter we have with folks on the streets. Finally, fifth, we do need all tools in the toolkit to attack this epidemic. And that means, from a treatment and housing standpoint, low barrier treatment, where we're able to get folks off the street very quickly. We also need to better utilize recovery-oriented treatment and housing. And that is a part of our continuum that we've not invested in sufficiently. You will see us affirming all of that because we do need all tools in the toolkit. So with that, I just want to close by saying I'm proud and privileged to be joining this team. There are some incredible people here, not just at DPH and other departments, but in the community and the providers that we get to work with. The overdose numbers, the magnitude of the crisis that we have, both from a public health standpoint, from a community standpoint, is exceedingly clear. You'll see us practically, quickly, proactively making pivots to what we're doing as a department. And this is going to keep me up every single night, hopefully not all night, and every single morning. This is what motivates me and our team to come into work. So with that, thank you, and I think we'll have time for some questions. Yeah.
I want to go back to when you talked about the safe consumption supplies. Sure. Just to clarify, two-part question. Yep. One, you said you do still support clean needles, but maybe are going away from foil or pipes.
Yes, and I want to be very, very clear about this, and this was explicit in the mayor's directive. We are San Francisco. We have been a national leader when it comes to public health interventions. There is long-standing, peer-reviewed, hundreds of peer-reviewed articles outlining directly the use of sterile syringe access and how that reduces the transmission of HIV, of hepatitis C, and actually helps people engage with treatment. And many of those studies and that evidence and that data has also been developed here at points in San Francisco, or has been very effective here. We are not shying away from that. You will see us as a department affirm and uphold evidence-based public health intervention. So that continues to be, I want no ambiguity that the department is moving away from that long-standing public health evidence-based intervention. You are also correct that the part that we are reassessing and expect to pivot policy on is the distribution of smoking supplies for drug consumption, particularly foil, pipes, and straws that are being distributed. What that policy looks like for being distributed in public spaces like sidewalks, streets, etc. I'm not announcing exactly what that pivoted policy is because we want to very rapidly be sitting down with our colleagues in the community, clinical experts, our providers to work through some of that, but you should expect that will happen extremely quickly, and that very soon, Deirdre, in X days, we will be back in touch with you all. But it is very important to me and Hillary and our team here that we are able to sit down with our partners in the community providers to work through that before we formally announce what that pivot, that change would be.
Okay,
Does that answer your question?
Yeah, quick secondary question. Sure. So a lot of times, folks are setting up tables, they have different supplies as well as Narcan and snacks and water. And so some organizations and providers have been concerned that if they're no longer allowed to set up that table and distribute the Narcan, it could lead to a rise in overdoses. So what would be your response to those concerns?
I carry Narcan around everywhere I go. Narcan, as well as access to medication-assisted treatment, are evidence-based, very clear, long-standing practices around that. So you will see us being thoughtful and tailored and targeted, and that's exactly why I'm not announcing what a pivoted policy will be today. We're being clear as a result of the mayor's directive that we will be changing the policy, but how we execute and ensure that the policy change allows us to be evidence-based and also continue things that we know work and are important, that is really key. And so my team will be meeting rapidly with a range of folks in the community over the coming week and a half, and before we roll out more of the concrete policy pivot. But those sorts of things are exactly the pieces that we have been thinking through and have perspectives on, but want to be able to work through with our provider community.
Natalia from the San Francisco Examiner. Can you clarify what the department's role is going to be at this new police-friendly stabilization center that's opening up this spring?
Oh, 822 Gary. Yes. Let me say a few things, and I'll actually ask Hillary to describe the clinical model a little bit more. But coming from outside of San Francisco, one of the very common parts of the system of care is to actually have what we call crisis stabilization. So when you have somebody with substance use disorder, mental health, co-occurring conditions in need of support, but maybe not at a level where they need to be in an emergency department, crisis stabilization units, which are typically under 24 hours, are a really important tool to help stabilize someone and be able to plug them into the next level of care. We have limited capacity around that here in San Francisco. It's something that is a really important piece. And so that is actually a clinical level of care. It is also licensed by the state as a clinical level of care, and that's what will be opening up in April at 822 Geary. So if there are any other questions, I can have Hillary talk about that in more detail if helpful.
Is this something that might work in tandem with this triage center that was tested out in Sonoma?
Just talk about the difference between them, and then just like a little bit, Hillary, the model about ambulance and.
Yes. So thanks for the question. So this is quite separate from the triage center. This is really, as Director Tsai just mentioned, a way to support people getting off the street who might be experiencing a mental health or substance use crisis that doesn't need an emergency department. The design, and what is very important to the department, that it is works with for police, potential public safety, and other first responder drop-offs. For example, our colleagues in the community paramedicine division, or colleagues in the police department would be able to drop off folks in need of some sort of clinical care. This is a model that's been used nationally. We have another crisis stabilization unit, the DOOR clinic, DOOR urgent care, that has many similar functions. I'll also add that we will be working through the regulatory structure to have this be what's called an alternate destination for EMS. That will be a little bit later after state approval. So we see this as a great opportunity to work in collaboration with our first responder colleagues to, again, as Director Tsai just said, support getting people off the street into care and then on to other levels of treatment and care that could be needed.
Thank you, Hillary.
Any other questions? Maggie, one more? Yeah.
So we reported previously, I think like a year ago, we asked about like the purchase or groups handing out foil or so smoking supplies, and it's my understanding that the city doesn't fund or like provide those. So how would it be able to tell an organization that it can't do it if it's not funding that?
So it's a great point, because factually speaking, we as the department spend very little on our relative budget on actually some of those supplies. We spend, less than a few $100,000 at most in many of our overall budget. Much of what happens is we do have a range of agencies, community-based organizations contracted to us for a range of services that also provide a range of those supplies, some of which are actually supplied by the state. However, we do hold contracts with these agencies, and I think the types of discussions we'll be sitting down with is for any DPH contracted provider or subcontractor where we hold a contract, we have the ability to sit down and say, hey, let's work together. What are the expectations for what our expectations are? And that is kind of the authority that we have to engage with folks, even when we are not directly funding all of those supplies.
Okay. Last question, and then I think we'll wrap it up after that.
I'm Cami with KQED. Just for clarification, so when you talk about the reassessing, the syringes and the materials provided for smoking, so it's just the syringes that are being touched on, or like why not the other?
I just want to be very clear. We are not, the reassessing is not about the sterile syringe access. So maybe let me just say this again more explicitly, and if it's not clear, please just ask me. Let's separate out supplies into two categories. The sterile syringe access, as opposed to the smoking supplies for drug consumption like foil, pipes, and straws. on the first part around the sterile syringe access, that as a public health intervention has been around for decades, and there is decades of peer-reviewed, evidence-based literature that conclusively continues to prove that the use of that sterile syringe access as a public health intervention absolutely reduces HIV transmission, hepatitis C transmission, and also helps people get plugged into treatment. So I want to be exceedingly clear, and this was clear in the mayor's directive, San Francisco is not backing away in any way, shape, or form from that time-tested, proven public health intervention of sterile syringe access. Full stop. The policy that we are reassessing and will pivot on is agencies distributing the smoking supplies like foil, pipes, straws, particularly in public spaces as well. Does that help answer your question?
Yes,
Thank you for asking.
Okay.